So thanks everyone for joining us today for this discussion about how COVID is impacting working women in Montana. My name is Kylie Gursky. I am the program officer at the Women's Foundation of Montana, which is a program of the Montana Community Foundation. My pronouns are she, her, and hers. And I'm joining you today from Missoula, which is original territory of the Bitterroot Salish. The panel today is part of the Women's Foundation of Montana Powerhouse program. Powerhouse is an online platform that connects women across our state so that together we can work for economic empowerment for women in Montana and a brighter future for girls. So the Women's Foundation also makes grants to nonprofits that support women and girls, and we advocate for policy change that helps women build up economic power. So some quick housekeeping before we get started and talk with our panelists today. We are recording this session. We'll keep mics muted so that we can clearly hear the panelists speak today. And if we have time for questions at the end, we'll go ahead and unmute people, but feel free to use the chat feature throughout the webinar to comment and to talk with each other and connect. And for now, if you all want to enter in the chat your name and where you're joining us from, it's really nice to give panelists an idea of who is listening and who's engaging. So if you want to do us that favor of just introducing yourself via chat and sharing where you're from. Hi, Morgan from Missoula. Thanks for joining us today. That would be great. All right. Hi, Grace from Missoula. Thanks. And as folks are sharing that, I also would just like to introduce Kelly Curtis, who is the Women's Foundation AmeriCorps Vista member this year. And Kelly, would you like to introduce yourself to the group?
Hi, everyone. My apologies in advance. I have a little bit of laryngitis, so I sound a little hoarse. But yeah, like Kylie said, my name is Kelly Curtis. I'm the AmeriCorps Vista serving in Helena with the Women's Foundation and the Powerhouse program this year. I have been recently introduced to the role, been in the program for about a month, and I will be helping to monitor the chat and take notes. And if you have any stories that you would like to share of your experience during COVID, you can email me. I'm going to be dropping my email in the chat several times. We would love to hear your stories about how COVID has affected you personally or professionally.
Great, thanks, Kelly. And supporting our webinar today also is our Montana Community Foundation comms team, Teal and Kristen in the background doing amazing work. And today I'm most excited to be joined by our incredible panelists who do really impressive work in our state. Tanya Plummer, Lori Gendron, and Morgan Slemberger, who are not only hardworking women and mothers themselves, but do a lot to support working women in our state from a variety of different pathways, working with Native Americans to build financial sovereignty, supporting frontline healthcare workers, and supporting women in business who are often underrepresented in the business sector. So thank you to all three of you for joining us today and for the work that you do. And we'll do introductions and I'll hand it over to these three in just a minute, but I just wanted to give a little bit of framing for our conversation today first. Each of our panelists, they're going to share how the women that they work with have been impacted by COVID over the last year and a half and continue to be impacted because as we're realizing we are far from through this. But we also, as Kelly mentioned, we want to hear directly from you. We know that each of you and your families have been impacted in some way by this pandemic. And so if you're willing, there's a brief survey that the Women's Foundation is conducting, just trying to collect some information about how women who are invested in our work and attend our programs, or maybe this is the first program you've attended, how you and your family have been impacted by COVID. And if you're willing to share, a longer story. We've had women who've reached out to us from across the state to share about their struggles in finding elder care and in childcare, and just the many different things that communities have faced over this last year and a half. And we know there's power in sharing those stories and in connecting with one another. And so it's important to us that we make some space for that. So it's no secret that women have been disproportionately impacted by the pandemic. In the spring of 2020, between March and April, just 2 months, some 3.5 million mothers living with school-age children left the workforce. Gender equality in the workplace was set back more than a decade, at least a decade. Some folks are saying 30 years, some folks are saying more. We haven't really seen the end of this impact yet. And women were feeling burned out at a faster rate, which comes with very serious mental and physical health impacts. And a year and a half of coping with the COVID pandemic, like I mentioned before, we're not done coping with it and facing the realities of it right now and the ongoing impacts. So we have companies that are going back to in-person work. We have frontline healthcare workers who have been at work and been dealing with the health impacts, but also the work impacts of the pandemic. We have businesses and schools that are reopening, and we're now dealing with the realities of the Delta wave. So we saw massive job loss and really incredibly increased care responsibilities for women, which is adding a whole new set of challenges for women in the workforce, on top of what was existing pay inequities, discrimination, and inconsistent workplace policies. And we'll continue to see the impacts for years. So our discussion today will focus on specifically how women in Montana have coped over the last year and a half, and what actions we can take to better support working women across our state. So let's meet our panelists. So I'll allow them to introduce themselves, maybe just take a minute and share a little bit about yourself and the organization that you're connected with. And let's start with Tanya.
Thanks, Kylie. It's great to be here. It's great to share this space with all of you today. I'm Tanya Plummer. I'm the Executive Director for Montana Native Growth Fund. We are a Native community development financial institution. That's a nonprofit community development lender that is based on the Fort Belknap Indian Reservation in north central Montana, but we do serve Native Americans across the state of Montana. Our primary focus is housing and homeownership. That's a space where we see significant disparity with regard to even the creation of housing stock and financing opportunities for Indians who want to live within the lands that the government gave them during the treaties. So a lot of deep work to be done in that space, but we found that the conversations that we're having with folks who want to own their own home, living at home on the reservation, are much bigger than just housing and home ownership. You know, in order to qualify for that home, they might need to create a side hustle of sorts and start their own business in order to have sustainable income to get by at home. And a lot of times, grow their own garden or work in the space of food sovereignty, because most reservations are so rural and there's just not availability of fresh produce and things like that on the reservation. And so we realized pretty quickly that our service is a very holistic conversation with the clients that we serve, and we learn about their entire life. It's not something that's a siloed conversation. So absolutely love this work and feel called to it more than anything I ever have in my life, and I'm grateful to share with all of you today.
Thanks for being here, Tanya. Lori, do you want to go ahead and introduce yourself?
Hi, everyone. My name is Lori Gendron. I'm so glad to be with all of you. Appreciate the invitation, and it's lovely to sort of Zoom, see, and hear everybody. I work as a political organizer here in Montana for a labor union that operates here called SEIU, the Service Employees International Union. Our local is 775. And we are a healthcare union that represents direct care frontline sorts of healthcare workers. So I'm really looking forward to the chance to kind of dig in with all of you as to what that means and what sorts of things have impacted, especially oftentimes I'm the vessel that gets to spend lunch hours in other places to help maybe you understand what our union members are facing in their line of work, especially during a time when getting away from essential work is not really an option, right? So thanks again for having me join the conversation. So appreciate it.
Thanks for being here, Lori. And Morgan, would you like to introduce yourself?
Yeah, my name is Morgan Slumberger, and I'm the Director of Women's Entrepreneurship and Leadership at University of Montana. So I have the good fortune of getting to support business owners at any stage, so aspiring or current business owners to start something. And we're starting to provide also leadership training to women across the state in addition. And so I'm really excited to be here and hold both Tanya and Lori in high esteem. It's going to be so lovely to hear from both of you more. So thank you, Kylie.
Thanks, Morgan. I just think that, I agree and want to echo that the three of you, I think, have some incredible insight to offer based on your experiences supporting women across the state, and I'm excited for our conversation. So thanks for being here. And before I kick it off to questions, I just want to start us off with some statistics, which I think we all have been hearing in the news. So I don't know if they'll be shocking to anyone, but they paint a pretty grim picture. We know that when it comes to childcare, a lack of access to childcare in Montana was already hurting parents in the workforce before the pandemic. At the height of the pandemic, 171 childcare programs had closed, and about 42% of parents said that they couldn't afford childcare services. When it comes to frontline workers, we know that nationally 3 in 10 Native American women are working on the front lines of the COVID-19 pandemic as essential workers, yet they face a staggering pay gap. Currently, it's 60 cents to every dollar earned by a white non-Hispanic man, and that the pandemic could widen that wage gap even further. We also know that mothers in low-income families, disproportionately women of color, are far more likely to be breadwinners than mothers in higher income families. So more children are dramatically impacted by the loss of work or the stress that being a frontline or essential worker during the pandemic placed on those families. We also know that the health toll that the pandemic took on frontline workers was pretty drastic. There have been several surveys, but one of the most recent surveys that I read said that almost a quarter of frontline healthcare workers reported symptoms that would align with probable post-traumatic stress disorder, and that 43% reported probable alcohol use disorder, which will have just lasting impacts for those individuals and for their families. And we know that job loss, women specifically overall, lost a net of 5.4 million jobs during the pandemic-induced recession, and have recovered only 55% of the jobs that were lost in that time. And right now, among unemployed women ages 20 and older, nearly 2 in 5 have been out of work for 6 months or more. We also know that employment statistics for women of color were not only more severe when COVID-19, when the pandemic began, but are more sluggish in improving. And again, I know that paints a grim picture, but I also know that there are some things that we'll discuss today that give us hope for what we've learned and what we can do as we recover that better supports women. And so, Morgan, I'll ask you my first question, which is researchers are saying that women's progress in the workforce has been set back 30 years. As someone who was working to help women make progress in the workforce as leaders, business owners, executives, or nonprofit directors, how do you see that research reflected in your own work? And have you seen the women that WELL supports experience that kind of setback? And why do you think that setback was so easy to happen?
Oh gosh, that last one is a zinger. But I think I'm glad that you're bringing up research, because there are research reports that I'm sure a lot of the amazing advocates on this call have already seen. But the National Women's Law Center is a really great they have a lot of publications and research, or they're compiling data and fact sheets for during the pandemic. And McKinsey annually has a Women in the Workplace report that I'll be referring to throughout this whole panel. But I think what's significant to me, and the numbers that Kylie mentioned are huge, but over the last 20-ish months, or however long we've been in this, so many women have dropped out of the labor force. So between February to February, it was 2.3 million women and 1.8 million men. And then since the labor force, I think it's since September 2020, 5.86 million women have left the labor force. And that the last largest exit from the labor force was in 1968, and that's 550,000 women. So when we say women are leaving, that's in large rates. Now, of that population, I don't know the percentage of baby boomers who were already planning to retire in the next 5 to 10 years, which would be an interesting statistic for us to know. But what I'm very curious about, the reason I'm highlighting this data, and anybody, please reach out to me. I'll put my email in the chat. I am very concerned that there hasn't been wider data spread about Montana and our state, like what's happening in the workforce. There are numbers and there are some census statistics, but as we know, the census doesn't cover a lot of people of color and a lot of people in poverty. And this year in particular was a very difficult year for them to collect the data, or I mean 2020. So all this to say, we're missing a lot of data in general. But what data we have and what data we need to conduct as a state, I'm very interested in that. So if there are like-minded people, please reach out to me. I am working on it and did get a grant to start working on some of that as well. So also the other finding in McKinsey is that just burnout for women is a huge problem, and more so even than a year ago. So 12 months ago, we thought we had it. And now, no, with the Delta variant, women are, and I'm sure Lori and Tanya both see this more, but the healthcare workers especially. So in my work, how I see some of these statistics reflected, my work is really focused on supporting women in the workforce and supporting women who are starting businesses. That's my primary bread and butter. And so you can imagine how many women in business who own their own business, and statistically across the country, women own smaller businesses. They're probably the lead of their organization, and then they're having to balance childcare, they're having to balance whatever elder care the coronavirus has put on them. And so business became very hard from that perspective, having kids at home. But then in addition, like no customers at the beginning of the pandemic. So that was really, really terrible. And then navigating these funds that have been released by the government, that was helpful, but only a Band-Aid. A lot of women who are providing retail or service-based businesses, unfortunately, will be closing their doors if they're a brick and mortar shop, and that's happening around the country. So all this to say, there are a lot of women who are struggling. The other piece that's very interesting is sick leave. COVID sick pay is no longer a reimbursable thing, I think, at the federal level for a lot of organizations. So you can imagine how that affects everybody, not just like women leading a business, it's their employees, it's everybody. So now, especially if somebody's working for a retailer, in a service-based job, they get sick or their family member gets sick, what are they going to do? They're in a predicament where they have to take time off without any pay, and that doesn't help anyone. So that's been a tough thing because the women who are portrayed in a lot of these stories are service-based industry women, and so they don't have the luxury to take that time off, and it's just so complicated and sad. It's like so emotional for me. I feel it viscerally, and I know all of you probably do too. So I think the other piece of this that I will say, there is a silver lining here for the work that I'm doing. Because some women have left the workforce, there have been upticks in Missoula at least, and I'm not sure about the state data, I'll work on that. Of women starting new businesses, and incorporating businesses. So that would be one thing that's a positive here, is that maybe for some women, they've been able to reevaluate a little bit and maybe figure out a new way forward. And maybe that's through business ownership, Maybe that's getting out of a job that they already disliked. And we actually have some testimonials from some of the courses we're running right now for the general public on some women doing that, shifting careers. But I think there are opportunities now where women are able to reevaluate and really put their energy into something that works for them. And sometimes business ownership can provide a little more flexibility than an employer can.
Great, thank you, Morgan. I appreciate you sharing the silver lining about that uptick in women opening businesses, which is often a pathway to economic independence for women and healthier workplace. And appreciate you sharing that. Tanya, my next question is for you. And Indigenous women have been disproportionately negatively affected by COVID. Your organization, Montana Native Growth Fund, is a community development financial institution, or a CDFI. And for those of you that aren't familiar with CDFIs, Tanya talked a little bit about it in her intro, but they're often called the financial first responders, and were called as such during the COVID pandemic, stepping in immediately to assist small businesses and nonprofits and individuals. And as we know, Native CDFIs have been the financial first responders in their community long before the pandemic. Can you tell us a bit about who your clients are, what they faced in coping with the pandemic? And do you think Indigenous women, business owners, nonprofit leaders, and frontline workers in Montana face unique challenges during the pandemic?
Thanks, Kylie. Yes. Our clients are they're workers trying to take care of their families and stay afloat. They're just trying to keep their heads above water. They're just trying to keep their bills paid and their families taken care of. And so these are just gritty conversations that we're having from folks calling and coming through our doors with just help. There's so limited access to capital in Indigenous communities. This is a place where banks typically don't step in, credit unions don't step in for the types of needs that we're seeing. And so we have to be creative about working in this space. And so we designed a workforce support loan that's up to $1,000, that's low interest, and it can be used for anything that can keep you working. You know, most of the workforce within the Fort Belknap Indian community went virtual, thankfully, because of PPP loans and things like that. There were very few loss of jobs, which is, I feel like, a flex for our tribal community. And we're very proud of that because we didn't see the loss of job that we've seen in other areas. So it was beautiful, but it became really hard to stay working because now that you're at home, you've got all of your kiddos at home and you're trying to school them at home at the same time. And maybe you've had to go out and buy 3 laptops for your kids that you didn't have before that the school can't afford to give you. And so we did loans for things like that. Most of our homes are overcrowded and multi-generational. And so bringing kids at home to learn and a primary breadwinner, who's usually a woman, home to work at the same time and teach while caring for elders, it was just very, very complicated. And so when things began, when the virus began to spread, we had, you know, you're 3 hours away from Billings. And so it takes, you trying to get healthcare is not easy in your tribal community either. So we did loans for like traveling to Billings or having weekends away to go see your loved ones and take your kids with you at the same time because there's no childcare at home. You know, we had tires blowing out and people that were overusing their cars. These are just those real practical things that we don't even think about as being taxing, but they really came up over and over and over again. So we did a lot on the smaller scale to try and meet the demand of each of those families. Because they still were able to work, we did have those who had extra money coming in from stimulus checks and the child tax credit. And so we spent a lot of time teaching and coaching on how to make the best use of those funds and budget them into what they already were trying to build as a budget so that they could maximize the use of those and make sure that it was used wisely. And so we spent a lot of time teaching on that too. So. I guess your second question, I think what did you ask me? The second question was,
The second question is just, do you think Indigenous women are facing unique challenges when it comes to COVID-19?
Yeah. So I think Indigenous families have a value system that doesn't always line with Western society values. We think of things very holistically, and the concept of time management and our family is unique and different. And so when you're in a Western society position, showing up on time, performing, attaining, those things become crucial as part of your job performance. In Indigenous society, when time stops, it's okay, because what we're doing right now is the most important thing, because our family is the most important thing. And that's a different kind of a value that's held, that's not always embraced by somebody who is looking at it from a different angle. And so I think just bridging the gap between those two different value systems is important. And for that reason, you know, when you're going to drop everything because you've got to cook meals for other families, you've got to take care of nieces and nephews and kids and rides and all of those things, and make sure that you're getting your work done, there's much greater challenges on that front.
Thanks for sharing that. I know that there was a lot about the, you know, sort of traditions of the Western workforce that wasn't working for Indigenous women before the pandemic. And I can only imagine the kind of pressure that the pandemic has put on Indigenous women, and the care responsibilities that are faced in the thank you. So Lori, my next question is for you, which speaking a little bit about the stress that those who work on the front lines of healthcare are experiencing right now. We see health systems and healthcare organizations being overwhelmed and without infrastructure and resources to support physicians, nurses, and other care team members. SEIU members were deemed essential during the pandemic and applauded, or for example, in Missoula, we howled during shift changes. This was early on in the pandemic, and yet many were at that time and still are struggling to make ends meet. So can you tell us a little bit about your members and what they've been dealing with over the last year and a half?
Sure, I can do my very best to do that, while also saying ditto to an awful lot of the things and amplify in that sort of quicker than I usually communicate way some of the things that Morgan and Tanya have shared so far. So I'm guessing there might be some familiarity with labor unions in our group today, and maybe some who aren't. So I may have mentioned this when I introduced myself, everyone, but at SEIU 775, we're a healthcare union very specifically, and we represent direct caregivers in 2 states, in Washington State and then here in Montana. They comprise a range of different kinds of caregivers. So our union members that are caregivers in Montana are doing a number of things, whether they're providing in-home care to clients that are staying home and relying on caregivers to help make that happen, whether they're working as CNAs, certified nursing aides, or dietary aides, or some other sort of support sort of staff function in a nursing home, or whether they're giving care in places like group homes and other places where they have clients that have need of care and housing due to their own range of different kind of ability and or mental illness, whole range of stuff. But all of our members are providing that kind of very direct, frontline, hands-on kind of care. We also represent some Montana workers who provide care in different ways, and we typically think of it in healthcare. So folks that work in early Head Start centers, folks that work in case management in their healthcare systems, those kinds of providers of a certain kind of care are our union members in Montana as well. If you are familiar with, organized labor unions and or labor history to any degree, I think maybe you might be familiar with that notion that some professions have had access to a union, that ability to organize and build power specifically in an organized labor environment, right, for quite a while now. So when I say that, I think of some of the essential professions that we've noted, certainly before in our culture, but with much more emphasis now during the pandemic, like teachers and nurses and firefighters and other first responders. Those kinds of occupations have often had some access to a union affiliation and the benefits that hopefully provides, right, for decades now. So a relatively long time in recent history, right? I was actually a union kid myself. My dad was a firefighter all of his life. So I was a kid in the 70s and 80s. So if you want to do math, you can get a range there. But that was also during a time when places like my father's own firefighting union was a pretty strong time in the recent history of labor in our country, right? My parents married quite young. College was not a path they pursued. And this kind of the stability of his career was really an entrance into a middle class for us that as farm kids themselves, my parents would not have yielded elsewhere in a lot of cases. He always ascribed that to the strength of having a union on his job and in his very essential work. So, for folks like my parents, they were arguably kind of the last generation, at least in recent history, that could pretty reliably carve out a life that was somewhat comfortable some of the time. And those kind of represented and protected union jobs were a part of that. They had had some time and some decades and some power and some contracts to negotiate and some other things that helped make that happen. So just by way of contrast, our healthcare union at SEIU 775 is also relatively new in that kind of history, because the healthcare workers that we represent are those workers that are at the very front lines. I mentioned some of those job classifications, right? So they have not had access to an ability to often organize in a union environment until very recently. So for example, our union here in Montana has represented our caregiver members for just a dozen or so years now. In part, I think, due to that sort of relatively short amount of time for these super essential workers to come together and build that kind of power in a union environment, we know for sure that our union members are still working in jobs before the pandemic that were way undervalued and underpaid. And also, maybe because of that kind of undervaluing and underpayment, terribly, terribly, terribly underfunded at our systems levels. Since we know that those public funding streams like Medicaid and Medicare and others are really what employers, whether they're privately owned or not-for-profit or some other kind of healthcare structure, are relying on to provide care and to pay those caregivers that are working in those environments. So maybe it helps it to try to imagine. I think I mentioned that I take a great deal of pleasure and find it a big honor to be able to come and share some member sorts of experiences with you instead of my own. So if you can think about it this way, maybe this will help. So you're working in the laundry and linen department of a nursing home up in Libby, Montana. And you've got 3 school-aged kiddos. So you're caring for your family too. You make about $10.60 an hour, even after you've been at the nursing home really loyally for 6 years, okay? And then we all find ourselves in a global pandemic, right? So over the last couple of years in your work at the nursing home, you've been working the shift at that facility that most closely mirrors when your kiddos are in school, just to try to make all of this work. And it's always a struggle to make it work. And you're always right on the edge of making that work, but that's what you've been doing. Okay, so pandemic. Now the 3 kids are online schooling at home. During those hours that you have relied on, where they could be in school at least most of the time, unless kiddos are having sick days or holidays or other things, right? And you can try to make all of this work. All these balls are in the air all the time. You're juggling them all the time. Your work has immediately become scarier, more risky for yourself, for the residents that you help care for at your facility, and for your kids. Again, they're at home now. Maybe, I mentioned that you're in Libby. You might also live in a community that has its own sort of culture and worldview that might be a little slower in some regards to embrace what we're all trying to learn together when something like a health-related pandemic hits. Okay? And I'm going to say it again because, I'm going to focus on wages just a little bit. You make $10.60 an hour. Okay? Or maybe, when I think of another one of my union members that works in Butte in group homes with with clients who have fairly pervasive, different kinds of abilities and needs of their own and need that kind of care in a group home setting. So you've been with your company that provides that care for almost 20 years now. And after that time and doing what you can and forming a brand new union a few years ago to hopefully give you some strength and solidarity among your coworkers to help make work better, you make about $13 an hour, okay? So your kids are grown, but they're also still local, right? They're in Butte, America all together, you know, as a really cohesive family. And they're at a stage in their lives where they really want and need your help as much as you can offer it with your grandkids. And who doesn't want to like be with their grandkids all the time? My parents said that getting my son was the only reason to really have me to begin with, right? So that's the situation that you're in. So in order to try, again, to keep these balls in the air and keep it moving and make this work and try to eke out, you know, what you want and hope and need for your family, you switch to night watch, which is usually like an overnight shift in the land that I and my caregiver members live in, right? So you're working overnights, even though that's a brand new thing and not really gelling with your system to help with your grandkids, but also because a lot of overnight workers in a healthcare situation like that make an extra $1 or so an hour. And that happens for you. But then global pandemic hits, right? And you are right in the center of that same sort of storm that's swirling, right at that nexus between your clients, your family, you're working when everyone else is sleeping to make $1 more an hour to try to make it all work. And it goes on and on and on. So guys, when I thought about what to share, I decided I did want to focus a little bit on wages because that's important stuff. You know, I'm not a math major, never was one, but we all know what adds up and what doesn't. And because we represent as a union healthcare workers like the ones I've described so far, we're right here all the time on this edge anyway. And so for all of us to be living together as best we can through something as unprecedented as a global pandemic, you just can't. There's no room when things are good, whatever good might mean collectively, right? So to have folks in these situations and have these huge gaps open up for working families around education, around childcare, just trying to keep those balls in the air again, we have found that it has been incredibly, incredibly difficult. And we know, I think most of us, and if you don't, maybe you'll know now, caregiving is a very female-oriented occupation. Lots of good male Montana caregivers are my union members as well. And having said that, women and women of color are disproportionately represented in that workforce, right? So yes, thank you again for allowing me to help share. I guess what I would try to, help convey to a group like this is the math isn't working.
Yeah, thanks, Lori. And, studies that the Women's Foundation has sponsored before the pandemic certainly reflected, one, that nationally Montana is not competitive when it comes to wages, and even worse when it comes to wages for women. And so seeing, when things are good, that families are having a hard time walking that line, that when a pandemic like this happens, that folks are just so close to the edge. I appreciate the work of SEIU to help families have some economic stability and a little bit more power and in their working conditions. And Tanya, with that, I'll ask you, as a leader of a community-based organization, much like in the healthcare workforce, the nonprofit workforce is dominated by women. At some of the big budget nonprofits, women in leadership are scarce, unfortunately. But what we do know, there's been several studies of job applicants and in other companies, but that female leaders are found to be more empathetic and flexible as leaders in their organizations and companies. And I'm just wondering if you can share with us how your organization adapted to support your staff during the pandemic, and what advice do you have for other community leaders?
Sure. I think empathy is at the forefront of all of that, and it has been for me. Our organization has emerged during the time of COVID. We're a very new organization that became a legal entity in May of 2020. And so, we're right in the midst of that. We had to emerge virtually. And so that was building a staff virtually around a joint mission and vision, and laying out systems that would make it work in the midst of COVID. So we started kind of from behind. And so I think having empathy for my staff, most of my staff, not all, but most of my staff are women. And most of our 63.6% of our client base are women, 25 to 35, making about 40 to 55 annually. And so that's the bulk of our client base that we're working with. And so I think I had to be very understanding. We had to get really creative about increasing methods and modes of communication, you know, whether that was using Teams and text and multiple different ways of communicating and staying really a part of each other's lives, maybe going in ways that we wouldn't normally have done in a professional environment, but because we recognize that we're not just workers after a mission and vision, but we're women supporting each other. That was really important. Something that we saw our tribal enterprise do and that we tried to do also is, now that they're all working from a virtual environment, there's isolation and loneliness. And it's really hard to stay motivated with doing a good job at work while you're feeling so isolated and overwhelmed. And so we had to get really mindful and assertive about what we were putting out there to support our women workers. And so that looked like, and it sounds maybe silly, but it worked, recipe contests. We literally created a cookbook, but it gave our women a chance to like put something in, you know, and the men did it too. You know, we didn't limit it to women, but I think it really helped. We would publish in the morning things like different stretches for the day, or you know, aspiring thoughts and things like that. We began to really encourage education and increasing your education, expanding your education, and fostering a growth mindset, because the nature of our day-to-day work had shifted and changed so much that we felt like this is a really good opportunity to make the most of this kind of awkward downtime and learn something new. And I think that fostering and leading that kind of a growth mindset as leaders set a good example for our women and trained them also to be thought leaders in that space. But we had to be assertive about it. We had to be mindful about how can we create this environment for our women that encouraged virtual community and a connection and encouragement. So
that's great. I like the recipe contest idea. I have a few I could throw into that. Well, Morgan, I'd love to hear from you also. We've heard from Lori about the difficulties the things that working women have had to juggle over the last year and a half: childcare, schooling at home, elder care, potentially unstable or unsafe housing in the middle of a shelter-in-place order, and also, helping to take care of their own mental and physical health amidst all of that. So, what recommendations or best practices are you seeing discussed in the business sector for companies to implement that will help ease the care burdens for working women?
Such a great question, and it's a difficult question. And I also want to put an asterisk next to my answer, because we have an amazing childcare advocate on, Grace Decker, and I think we should do a follow-up with Grace and some of the projects that she's got her hands in, because she's an amazing advocate for women across the state in that regard. So I'll pose some of my thoughts, which might be a little bit different, but I think for me, it's a really difficult question, because Montana's economy is comprised of a lot of small businesses. We don't have the luxury of, a Google or all of these really large industry sectors. Like, we have growing technology, and we have so many people. Actually, there's now research emerging of people who have migrated to Montana during the pandemic, and at much larger numbers, and that they're bringing, some corporate ties with them, and some business relocations. But it's not, in a comparison, we're not even close to even some of our regional states. So when we ask for businesses to provide free childcare, we're asking a lot of small businesses, mom and pop shops. And although that'd be an excellent solution, how many can actually afford that? So I think on that regard, I know that there's some exciting activity happening in experimenting on how we support childcare. And I know I have a colleague who's really interested in doing a childcare hackathon of some kind. But I think there have to be collaborative interventions here, not just between the private sector, between the public sector, and that's going to take a lot of advocacy, I think. The other side, the more practical side of what employers can do is creating flexibility. And McKinsey has covered this. There's like a ton of articles on this, and you've probably heard it throughout the pandemic, like working from home when possible, flexible hours when possible. But workplace culture is really important. And I talked a little bit about burnout earlier, and that was a big finding from that report, that just now with the Delta variant, it's spreading faster. Hospitals are more full, more people are falling ill and dying even than a year ago. So with that, but we're back to normal, so you can imagine inside, I think we're all feeling that on the inside. It's like, oh man, this is a lot. So with that flexibility that some people have had the luxury to adapt to, like working from home, having more flexible hours. McKinsey suggests having clear boundaries that are set up for your employees, and that managers should actually model that behavior. So I would be a bad example for my employees, although I do take time occasionally, but turning off is really important so that your employees can see it. Then seeing you set clear boundaries, which I do with my kids, so that's good. But like, are there other ways where we can model that behavior so that we are more inclusive of what their needs are? So that's one big thing that we can do. There are also some, in an Instagram live that I did with a colleague, Christine, who was on earlier, I'm not sure if she still is, but we covered some really creative articles just on remote working and how you might be able to engage people and actually bring humanity back into remote work. Often, we get on these Zooms and they feel sterile, or you're looking at people, but you're not really looking at people, but actually there are arguments and research that's coming out that's saying you can actually make these better than your water cooler chats because there's more access to people that you normally wouldn't have access to. There's more visibility for people of color who might not normally get an opportunity to engage with somebody else because they're traditionally ignored. And McKinsey goes into this as well. Like, there are more people of color entering the corporate pipeline at different levels, which is magnificent, and like maybe the only silver lining of that report, but they're still not progressing as they should. So actually with Zoom, and when we think about whether we're small businesses or large businesses, we can still create culture, here. We can still, if it's intentional, if we have an intentional outcome. So I would say, like, I'll try and find those and send them to you, Kylie, because they're really helpful. The other thing that I wanted to note, so I think this gets overlooked, and I have a soapbox, so I'm just going to mention it. But I think we are in a labor shortage, and I talked about that earlier with the baby boomers, the mass exodus here. And when we think about the people who have left the workforce, baby boomers, and then we think about women, and if we want America to bounce back, and we want our businesses to grow, and we want everybody to, get back to normal, we've got to take this into account for women because they've just left. So many women have left. So if we're not thinking about flexible work environments, if we're not thinking about childcare as employers, if we're not thinking about all of these pieces, how are we going to solve this labor shortage, when they are a key piece of the puzzle? So I would say that these things really for employers and managers are so important as women do start to look up and say, I'm ready to go back to work. How are we greeting them when they're looking up? With open arms, or is it much of the same, that we were in before the pandemic? So I would say, like, thinking about not just pay, pay equity is significant, and absolutely, I'm a pay equity person. But I think the other pieces of the puzzle here that are expressed in research is flexibility, volunteer hours. Am I making impact and working for a company that's driven by a mission? How else are you meeting their needs, and how can you use, like if you are a small business, for example, or a nonprofit, how can you make this more attractive to them in a way that makes sense for you so you can still get your job done, but also that feels really good for them. And I guarantee it's going to feel good for employers if it feels good for your employees.
All excellent recommendations, and I think something that people are looking for in work. And I want to take our last few minutes and also ask Tanya and Lori the same question. And Tanya, I'll ask you first. What recommendations did you see proposed either at the state or at the federal level that helped ensure the health and well-being of Indigenous women during the pandemic? What would you like to see continue? What are the recommendations that are being made for folks in Indian country at this point about moving forward in a better situation?
I don't know that there's anything very specific that's come down at the state or federal level that's been a benefit to Indigenous women. I don't think I can think of one thing that's come down. I would say expanding the federal sick pay right now that ends September 30th would be key. You know, Delta is spreading so fast and there is no end to this. And so we're finding this cutoff date right in the midst of another rise. And so I think that that's a policy initiative that could be acted upon right now and should be. I also think, I don't know, who did you say? I don't see her name anymore, but daycare. I think providing childcare or some sort of means for that. One thing that our tribe has done is our tribe has subsidized childcare and opened up a Life's Language Lodge for newborns up to 5 years. Our administrative building of our tribal enterprise actually moved our entire admin staff to work at home environments and turned that building into a childcare facility so that those workers who were coming could have childcare right next to where they were coming to work. And that's a pretty cutting edge move. So our CEO, CFO, COO, all of those videos, they do not have offices anymore other than at home, which is fine because most of our work is virtual anyway, but we now have a dedicated childcare space for our workforce. And it is a language immersion school as well. So they're actively speaking Nakota and Aani and teaching those children culturally empowered ways. So it's just a beautiful model. And I'm really proud of what our tribe has done on that front. So I think childcare and the sick pay are big things. I also want to give props to what Morgan was saying earlier and all her words about looking at women holistically. I think when we treat a whole woman, we encourage her to give more of herself in the workspace. I think that's just super, super important. It's easier to do it in some sectors than it is in others. But when we help women see how their work can be an outreach of who they are, they're more readily willing to engage. Work feels good. Solving problems feels good. Working with other people and making things happen feels great. That's an encouraging thing for women. And I think reframing the way work looks in that light, I think will go a long way, but it means we have to kind of shift the way we manage and look at operations and all of those things as well. So I had a couple of notes that I wrote down on this front, and I just want to make sure I don't let this go, but I think I pretty well covered everything that I wanted to share on that front. So.
Thanks for that. And the childcare example that you gave that the tribe did is excellent. Thank you for sharing that. It's really ingenious. And Lori, I guess just the last question to you: what changes in policy can better support workers? You mentioned funding systems more robustly, but yeah, I'll let you jump in on this and share your thoughts.
Sure. Yeah. Thank you. I always want to be the last panelist to speak, especially, from now on after today, especially when I get to come on the heels of women like Morgan and Tanya, because I get to say ditto again first. Beyond that, though, and I did touch on it when we were talking a little bit more about, the role of organized labor and what unions do earlier, everyone, is a lot of it is dollars and cents, and not just in healthcare. A lot of systems are funded publicly, correct? But healthcare is one of them that relies on that very heavily. And so, yes, policy changes need to include better funding that flows all the way down in a system, whether you call it a trickle, a flood, whatever we need to do to get it there, to the women and men that are providing some of those direct care services that I've been talking about and sharing with y'all a little bit today. Unions, labor organizations are usually politically involved because of those reasons, and ours certainly are as well. And so that advocating, especially when all of us in a group like this link arms as activists that want to do that together, to do it in a broader way, is so, so, so important. Of all the things we've all tried to grapple with and live through, and will continue to throughout this pandemic, I tend to be one of those annoying people that looks for the opportunity as well. And when we're talking about publicly funded systems and healthcare systems, we've got a couple right now here in Montana through programs like ARPA. If that, rings true for all of you, there's these buckets of funding coming to states, right? That states have some discretion as to how those get directed back out in this kind of one-time only way to help some of these things that I talk a lot about, like recruitment and retention of really good caregivers, right? So advocating at the state level, but probably all of you are also paying attention at the federal level to some of those infrastructure packages that maybe the name of what we're calling it might change here or there, but there are things in some of those packages, everyone, like the direct care, healthcare, caregiver workforce being invested in as a form of infrastructure, right? As the baby boomers that we talk about move on to other things in life, retire, start to live and age, and maybe want to and need to access the kind of care that my members are providing, all of these things provide such important opportunities where we can require the folks that represent us and the systems that they're helping fund to do the right thing for the most people.
Great. Thank you so much, Lori, Morgan, and Tanya. Thank you to everyone who attended. I appreciate the perspective of the different sectors that each of you work with and what women and families are coping with and what would be most helpful to them. I think, Lori, I do think we've got some opportunities here to learn from some of the cracks that are very evident that we've seen over the last year and a half. And we can get creative. And I hope that there's a lot of momentum and will to see that through. And I think we'll see this week how some of those federal investments turn out. So everybody watch the news for that. And we'll send out a recording of this webinar along with resources that our presenters send to us. So there's more opportunity to learn from the sources that they're learning from and continue our conversation. And if anybody has any last thoughts to share, now's your opportunity. But I just wanted to say thanks so much. All right. Thank you, everyone. You enjoy the rest of your day and your week, and we'll see you again soon. Thanks again, Lori, Morgan, and Tanya.